Alrighty. Okay, so last bit I will run through as fast as I can. GI tract, oral esophagus, parts of the GI from like your mouth to your colon. And then there's anatomical disease, there's inflammation, and there's cancers. Basically, that's kind of the theme of this entire PowerPoint. So achalasia, the lower esophageal sphincter fails to relax, so then you have problems with like getting food through. Esophageal varices, so like you have impaired portal blood flow, so then it's like very easily ruptured and things like that. And then if it ruptures, you have bloody vomit. You can have gastroesophageal reflux, so like some of the fluid from the stomach goes up and burns the esophagus, and if it burns the esophagus too much, you have Barrett's esophagus, so you actually have a transition of the stratified squamous mucosa into metaplastic columnar cells, and then if super bad, then it can become adenocarcinomas, so cancerous. So just like this esophageal cancer, main cause is Barrett's esophagus, but squamous cell cancer, so a different type of cancer, different region up top of the esophagus, that's from tobacco, alcohol, achalasia, or hot tea. Stomach, again, inflammation, ulcers, or cancer. So you can have inflammation of the stomach caused by H. pylori. This can like chew out parts of your stomach mucosa, and eventually it can like form peptic ulcers if very, very severe. Causes can be like drugs, like NSAIDs, smoking, alcohol, things like that. Again, more causes. And then more inflammation can lead to ulcers because it'll like start to chew up more of your tissue if like prolonged. And then if you irritate the system enough, you can have cancers that form, like gastritis and H. pylori infection can lead to gastric carcinomas, and those gastric carcinomas can lead to like, it's the second leading cause of death worldwide. Small and large intestines, so again, the same idea. There's developmental abnormalities, vascular disorders, diarrhea, idiopathic inflammatory bowel disease, or other obstructions. So remember, Suglu, Fru, Laklu, Gal, Muglu, Glu for the disaccharide formation. Stomach is where you break down, start to break down proteins. The small intestine is where you also break down proteins, but a lot of fats, and then your mouth is where you break down carbs. Hirschsprung's megacolon is where you have this like abnormality by the colon, and it's not really formed very well. It's very disconnected with the rest of the system, kind of, and so you have to remove the aganglionic portion, the portion that has failed neurocrest cells. Ischemic bowel disease is you don't have perfusion to these areas. Hemorrhoids can form if you have lots of pressure in that system, mainly pregnancy or hypertension. Diarrhea, there's secretory, so cholera, osmotic with the gut lavage, cleaning out the gut, exudative with Shigella and Salmonella and Campylobacter, which we mentioned back in like the first unit. Malabsorption with Giardia or deranged motility. Idiopathic inflammatory disease, so Crohn's disease, you have skip lesions, so you can't detect with the sigmoidoscopy necessarily. And then ulcerative colitis, you can rule out with the sigmoidoscopy because it's one continuous retrograde segment. Crohn's disease, you will have rectal bleeding in half the patients, and common fever, very common pain, and fistulas. Ulcerative colitis, you might not have the fever, and you might have like tenderness in this, but no fistulas. Diverticulosis is like diverticulas. Diverticulitis is like having inflammation and the diverticulos. And then bowel obstruction, you can have herniation, so it sticks into a part it shouldn't have. Adhesion, scar tissues are sticking together. Intussusception is when like the intestine is folding on itself, and then volvulus is when it twists on itself. And then tumors, colorectal carcinoma, know the tumor staging, put it on your cheat sheet, and then now we're on to liver. Livers for filtering out like big stuff, kidneys for filtering out small stuff. Very reductionist. Bile is to help emulsify fats. You've got a portal triad that actually has 4 components: the hepatic portal vein, hepatic artery, the bile duct, and the lymphatic vessel. Hepatocyte function, you want to use it to kind of store different plasma proteins or make them. You also want to use it to, you have bile as an emulsifier, and you have unconjugated bilirubin, and once you add in that conjugation, then you can become water soluble, and once you're water soluble, you can create to this urobilinogen, and then that's what makes feces more brown. Now we go to hepatic injuries. So fibrosis, cirrhosis, so damage to the liver, and also like making the liver more scar tissue. You might find these different lab values, which you should have from the lab medicine PowerPoint earlier on. Consequences, I'm not going to run through them, but jaundice and cholestasis are pretty well known. So jaundice, accumulation of excess bilirubin in the blood, so you might see like yellow eyes associated with like liver damage. Cholestasis is the gallbladder is like very stiff, gets blocked, not very good. Hepatic failure, the liver itself kind of dies. Very much destroyed. Cirrhosis and portal hypertension. You'll see ascites, so edema of the abdomen. You also see splenomegaly or these esophageal varices, which we talked about like right here because like of all the acid that pumps back up from the stomach. Caput medusae are these veins that have a lot of blood flow through them, so you can see them. And then viral hepatitis, so remember HAV and HEV are the ones that are similar. They don't cause cancer, they don't cause carrier state, they don't cause chronic hepatitis, not usually in the US, but it's oral fecal route transmission, whereas HBV, HCV, HDV are the bad ones. They can cause the carrier state, chronic hepatitis, and the cancer. And it has to be very close personal contact in the US, and it's present in the US. Hepatic steatosis, fatty liver, alcoholic liver disease has a lot of the characteristics we talked about earlier. Alcoholic cirrhosis, again, you'll see all these lobules that start to form, impaired blood flow. Hemochromatosis, hereditary iron overload, or you can have Bantu siderosis, so different types of iron overload that you can repair by phlebotomy. Obstructive biliary tract disease, so if you have gallstones or the tube itself doesn't fit very well, doesn't open up. Primary carcinomas of the liver, so you might have HCC, hepatocellular carcinoma caused by HBV, the hepatitis B virus. Cholelithiasis, so gallstones, so cola is gallbladder, lith is a stone, put those two words together, versus pigment stones, so they're formed differently, so risk factors for cholesterol stones, fair, 40, female, fertile, fat, versus risk factors for the pigment stones are the hemolytic syndromes. Choledocholithiasis is a problem obstructing the biliary tract, and so you can't get the fluid out into this region. And then also pancreatitis, very painful inflammation. Moving on to the male-female physiology, if you have the Y hormone, Y chromosome, then you produce anti-Mullerian hormone, which breaks down the Mullerian ducts, which would have formed into fallopian tube, uterus, and cervix for females. So females are default, and then once you have the AMH secretion, you can have Wolffian ducts that form for the male characteristics. Remember LH, Leydig, testosterone, FSH, Sertoli, sperm, and then for females, LH is in the corpus luteum, FSH for the follicles. Benign prostatic hyperplasia is compressing on the urethra, so it's bad because it'll push on the bladder. Carcinomas of the prostate can metastasize, and the carcinomas are peripheral, whereas the benign prostate hyperplasia is right at the center, so you can feel it a lot easier. And then you have different viruses, bacteria, protozoa, ectoparasites. So syphilis caused by Treponema pallidum, genital herpes caused by herpes, cancroids are caused by Helicobacter ducreyi, and like they get progressively worse. So cancroids are worse than syphilis, are worse than herpes. Yeah. And then chlamydia, obviously caused by chlamydia, can also cause pelvic inflammatory disease, and it's the second leading cause of infertility versus PCOS, polycystic ovarian syndrome. This is the most common STI though, chlamydia, most common STI. Genital warts caused by HPV 6 and 11. So remember, warts are not cancerous, are not like neoplastic. Neisseria gonorrhea causes gonorrhea, and then Trichomonas vaginalis is caused by a protozoan, which makes the pH of the vagina more friendly. It's like more basic, so that bacteria that could not get in before now have a higher chance of infection. Scabies cause itching in moist locations. Pubic or crab lice are not the same as head lice. You can have basically for the menstrual cycle, like you are selecting a follicle which will become a Graafian follicle, releases the egg starts to become the corpus luteum, and then it'll degenerate if it's not fertilized. You have LH and FSH peaking right when the egg is about to be released, and you have positive feedback. Estrogen gets peaked twice, and then progesterone gets peaked with the corpus luteum to kind of maintain the corpus luteum. And then you have this pathway of like how the hormones all cycle around. You might see HCG if you're pregnant for the pregnancy test. HPV 16 and 18 do cause cervical cancer because of E6 and E7 proteins that block retinoblastoma and P53. You can have endometrial ectopic implantation, so like different things can happen like all around the body. You can have leiomyomas or uterine fibroids, so they're not cancers, but they're benign tumors of smooth muscle like all around this area. Endometrial cancer, again, it's the most common cancer of the female reproductive tract. Uterine prolapse, so if something moves into an area that it shouldn't, so if it like comes out, if it's everted. And then cystocele and rectocele, it's like the that part comes out as well. And then salpingitis are inflammation of the fallopian tube, so that can cause pelvic inflammatory disease. Pelvic inflammatory disease is like inflammation of fallopian tube, ovaries, or the uterus, difficult to palpate. PCOS, again, the most common cause of infertility, high LH, low FSH, and then irregular menstruation. You treat it with birth control. And then ovarian tumors, teratomas, so it's kind of like the cells kind of differentiated into a bunch of random stuff, became kind of like a very scary like thing itself. Ectopic pregnancy, if it's outside of the uterus, typically it's most found in the fallopian tubes, and these do not come to term. Hypodigitiform molar pregnancies, so they are like non-viable forms of pregnancy, so they have like a strange amount of DNA, so it's diploid paternal or it's triploid, so 2 times the father, 1 times mother, but they just get cut out. And then preeclampsia, inadequate blood flow to the fetus, hypertension, and eclampsia is like at a different stage. And then lastly, you got diagnosis of amenorrhea. So if there's no period, are you pregnant? Is there an HCG secreting tumor? If you're not pregnant, then it could be prolactin or like a tumor stimulating there. And we have beat it.